Welcome, my name is Giles. I refer to myself as the Medicare supplement guy. I've been in the insurance business for 20 years, and hopefully at the end of this little 20-minute presentation, you have a good understanding of Medicare, understand a little bit about how the different plans work on a very high-level basis, and be able to help yourself gather a little more information to make an educated decision when you choose a Medicare health plan. Medicare is real simple. They like the alphabet. There's Medicare A, B, C, and D. Part A of Medicare is kind of the hospital facility side of Medicare. Part B of Medicare is kind of the usage side of Medicare. Doctors, labs, surgeries, those kind of things. Part C of Medicare, Medicare Advantage. Part D of Medicare, the prescription drug program. Medicare Part A is generally free. No premium, you paid for that. That was that Medicare line item on your pay stub while you were working. Medicare Part B premium, a little over $100 a month. It is indexed, so it changes from year to year. And that's usually deducted from your Social Security check. If you're not drawing Social Security, then they will bill you quarterly. And now they're starting to work with their do a monthly bank draft for that premium. Part C, the Medicare Advantage plan, we'll come back to later. Same thing with Part D, the prescription drug program. Medicare is an 80-20 plan. You pay 20%, Medicare pays 80%, with no ceiling. So if you have a $200,000 bill, you have an exposure for $40,000. And that's why people get a Medicare health plan to go with Medicare, whether it be a Medicare supplement plan, which is kind of where I like to go. I'm more conservative, or a Medicare Advantage plan. Either way, it will limit your exposure, so you wouldn't get that big $40,000 surprise. Okay, if you're working, covered by an employer plan, and have more than 20 employees there, you don't need Medicare Part B. You can stay on the employer plan and take Part A only because it's free. And then when you go to retire, you can pick up Part B with no penalty. And the great thing about it is it protects your insurability. So when you pick up Part B, that starts the clock where you can choose a plan, open enrollment, guaranteed issue, with no underwriting. So to know what Medicare covers, it covers just about everything. In the Medicare and U book, it's usually around page 60. It lists what is not covered by Medicare, and you can see it's a very short list. So let's review what's not covered with Medicare. You have the 3 holes in your head, and that's vision, dental, and hearing, an eye exam and lenses, a dental exam, cleanings, caps, crowns, fillings, dentures, hearing exam, hearing aids. If it's a medical condition relating to any of those, so say you have a cataract, a macular degeneration, glaucoma, those are medical conditions, and those would be covered under Medicare. Acupuncture is specifically excluded under Medicare, and for the most part, if it's an elective procedure, so it's not medically necessary, then Medicare is going to say no. Pretty much everything else is covered. There's a few rare items out there. The most common is colonoscopy. I'm assuming you've had a colonoscopy by now. And Medicare does not pay for the party the day before. The drink you drink the day before to kind of clean yourself out is not covered by Medicare. Colonoscopy itself is, but the drink is not. If you show your drug plan card when you go to the pharmacy and pick it up, you get a discounted price. So now you understand Medicare pretty much covers everything, just a few things that are not covered. If you go to a doctor that takes Medicare assignment, they're basically limited to the Medicare billing rates. If you go to a doctor that doesn't take Medicare assignment, they can bill 15% above the Medicare amount. So start with the Medicare supplements. If you have like a Plan F Medicare supplement, basically it comes in behind Medicare and it pays the 20% that Medicare doesn't pay. And there's 2 deductibles with Medicare. There's a Part A deductible and a Part B deductible that pays both of those. And if you go to a doctor that doesn't take Medicare assignment and they bill 15% above the Medicare amount, it pays that 100%. Plan F premium is pretty reasonable premium. For some people, it is a struggle to pay that $100 a month premium. Then maybe a Plan N would be a suitable answer. A Plan N is much like a Plan F, except it has the Part B deductible, around $150. It varies, it's indexed, so it will change from time to time. You have a copay when you go to the doctor up to $20, and that's determined by the doctor. $50 copay, again determined by the emergency room for emergencies. And the other thing that it doesn't pay is it doesn't pay those excess charges. So if you do step down to a Plan N, just make sure you go to a doctor that accept Medicare assignment, and you won't have any troubles there. So Medicare supplements are pretty straightforward. If you have a Plan F and they take your heart out and they lay it on the table, take veins out of your legs, make spare parts, put it back in, get it going again, you'll pay $0 with a Medicare and a Plan F supplement. My mom owns a Plan F. All my physician clients own a Plan F. To me, that's a really strong testament on the beauty of a Plan F and how great it is. Medicare Advantage, on the other hand, was originally designed to save Medicare money. Unfortunately, today it costs you and me, the taxpayer, more for everybody on a Medicare Advantage plan than on original Medicare. Medicare Advantage plans, the tendency has been, rather than to raise premium, they strip benefits. So you have to watch every year during the open enrollment period and look and see, if your benefits haven't been stripped too much, you need to change plans. All Medicare supplement plans don't change. As there's changes in Medicare, they adapt with a Plan F. The you pay $0 stays the same. So Medicare Advantage plans, generally you have a copay for most everything. They kind of give away the cheap stuff. So the office calls, the routine lab work, the preventative exams, they kind of give those things away. Where they really hurt you are on the expensive things. Hospital stays, durable medical equipment, and the Part B medications. That's where the cancer treatments are. You'll find in those low-cost Medicare Advantage plans, you're actually going to pay what you would have paid if you had no health plan, just Medicare by itself. And that's a scary position to be in. And that's why I don't like them, because there's that exposure and your benefits change every year. So that's hopefully kind of gives you a little bit of difference between a Medicare supplement and Medicare Advantage plan. All Medicare supplement plans were written and designed by Medicare. The companies are choosing to offer those plans of coverage. They cannot tweak benefits. They're all identically the same. They can't make any changes whatsoever. If you go to a hospital, doctor, lab, or surgery, they're going to send one claim off to Medicare. Medicare is going to process the claim. They'll forward electronically to whatever supplement that you own. That's called crossover, and they tell the supplement what to pay. And then the supplement will pay your provider. And generally, the supplement gets a check to the provider before Medicare does. With a Medicare Advantage plan, the insurance company is managing your Medicare instead of Medicare. So they send a claim to whatever insurance company you have with a Medicare Advantage plan. And that's the slight difference in the way claims are, but either way, the doctor, hospital, lab, they're going to send one claim out. And with a Plan F, again, you have virtually $0 out-of-pocket expenses. No coverage, again, for the 3 holes in your head, elective procedures, acupuncture, drink for the colonoscopy. Medicare is really simple that way. Hopefully that gives you a framework of the simplicity of how Medicare works. I'm a true believer, I'm conservative, I guess, in a Medicare supplement plan, specifically a Plan F. There's a few people that are tending to show more Plan G now than a Plan F. Plan G is just like a Plan F, except it has the Part B deductible, around $150, and again, that will change as time goes. But if you divide that deductible by 12, add it to the monthly Plan G premium, compare that premium for the lowest Plan G on the market to the lowest Plan F premium on the market, you will find if the Plan F is at the lowest, it missed it by a couple of bucks. I myself would much rather pay that deductible a little bit a month rather than have that front end charge at the beginning of the year. So you understand the true thing that Medicare designed Medicare supplement plans, and there is no difference. We relate it to an egg. You're gonna bake a cake, and the recipe says that you need 4 eggs to make the cake. You go in the fridge, and there's only 3 eggs in there. You need to go to the store and get 1 egg. Which egg are you gonna buy when you get there? It doesn't matter if you get the cheapest egg, the most expensive egg, the organic egg. They're all the same. They're gonna make the same cake. It's gonna taste the same. It's gonna feel the same. That's how Medicare supplement plans are. Medicare designed those. The companies are choosing to offer that plan of coverage. And again, they can't tweak the benefits. They're all the same. And premium is everything. Medicare put out a publication, the Shopper's Guide, usually on page 19 of the Shopper's Guide. And in bold print, it says that many companies will change varied rates for exactly the same coverage because they can't tweak benefits. A Plan F is a Plan F is a Plan F is a Plan F from every company. There is no difference. Premium is everything. If a company were to default, I haven't seen it happen, but if they were, that triggers guaranteed issue. You can go to another carrier without any underwriting, and they have to take you, they have to pay for you. Every insurance department that I know of has a pool that they make insurance companies participate in, that if a company did default on a claim, claims are paid. So it's really important that premium is everything. Most of the Medicare health plan carriers you won't have heard of before now. And the reason is they're primarily senior product companies. And because their primary products are senior products, you just wouldn't have had the need to see them before now. And in a nutshell, that's kind of Medicare made easy. And hopefully the agent that introduced you to this, whether it's myself, somebody I work with, or another insurance professional like myself, you trust them. They do a good job of taking care of you and servicing you. I expect all my clients and anyone that's going to introduce this to you to be in contact with you at least twice a year, once in the fall before open enrollment season, on drug plans and Medicare Advantage plans, kind of go over the rules again, and kind of touch base with you if you think you need to make changes in a drug plan. On the Medicare supplement plans, they should be in touch with you when your birthday comes or when your policy anniversary comes to review that before you see the rate increase from your carrier. Kind of the last thing I want to touch on before I let you go is the prescription drug plans, Medicare Part D. So if you have a Medicare Advantage plan, you have to have their drug plan. You don't get to go out and choose your own drug plan. You'll find the benefits there tend to be not as rich because they don't have to be. Unfortunately, they kind of got you, and you have to go with their drug benefits. The beauty of having a Medicare supplement plan like a Plan F, you get to go out and choose among a couple dozen drug plans, the plan that's most suited for the drugs that you're taking. And if your drug mix changes during the year, generally it's going to take care of you. It may not be the best answer for the rest of the year, but every year you have the opportunity to review the drug plans and move if you're taking something new. A couple rules of thumb with Medicare. If you do take a new drug, make sure your doctor calls the provider number on the back of your ID card so that he can make sure he's prescribing a new drug that's covered by the plan. It'll save you a little bit of trouble before you get to the pharmacy and find out you need a prior authorization or something. If you get a flu or pneumonia shot, they're covered by Medicare Part B, and generally there's no out-of-pocket for those. A tetanus shot and a shingles shot covered by Medicare Part D, the prescription drug program. So if you have a plan with a deductible, they're subject to the deductible. If you go to your doctor and he wants to give you a shingles shot, you go to the emergency room and they want to give you a tetanus shot, you're going to end up paying for those. And then you have to go through a cumbersome process to get a form from the drug plan, file a claim, and get reimbursed. Rule of thumb, every shot, vaccination, flu, pneumonia, tetanus, and a shingles shot, get them at your local pharmacy. They can give those to you. They can bill Part B of Medicare, Part D of Medicare. You'll always pay what you're supposed to pay, and there's no surprises or headaches. And that's one ground rule there. The last thing I want to leave you with is, if you're seeing this, you're generally someone that's pretty new to Medicare. And Medicare, in the first 12 months, you're covered by Medicare Parts A and B. You're entitled to a Welcome to Medicare physical. When you go and schedule your physical with the doctor and that Welcome to Medicare physical, make sure that you tell the doctor this is your Welcome to Medicare physical. When he gives you the order to go see the vampire, get some blood work done, make sure you tell the lab this is the lab work for the Welcome to Medicare physical. It'll save you and your agent a little bit of trouble in getting something rebuilt because they coded it wrong. But if you forget, that's not a big deal. Coding problems are pretty easy to fix. Just a reminder again, with a Plan F, you should have 0 out-of-pockets, no deductible, no copay. If you get a bill for something the first time, you need to ignore it. Normally by the next billing cycle, Medicare and the supplement have come in and paid, and the bill just goes away. But if you get a second billing for the same thing, then call your agent, and he'll walk you through what he needs to see what happened with the claim. Usually it's a coding problem, and those, again, are pretty easy to fix. Good luck. What we have for you at the end here is a form. It's strictly voluntary. If you want an agent to help you enroll in a plan, if you provide the information that we ask, we'll gather the facts. We will send you plan-specific materials for you to review at your leisure, nobody beating on you. And you can call with plan-specific questions, and your agent will answer all of them. We're here to take care of you, and hopefully you choose to use an agent, someone that is always there as a batter. You always get the same guy when you call the phone, and you're not frustrated with the phone tree that you'll get with an insurance company. Again, thank you, and good luck in your choice in choosing a Medicare health plan.